Hi everyone, this is Dr. Matt, and you're listening to Take Back Your Health, where we talk about all things health and ways to help you be the best version of you. Hey everybody, what's going on? This is Dr. Matt, and today I wanted to talk about what exactly is chiropractic. A lot of people probably don't know what chiropractic is. I'm always astounded, actually, how many people have not been to a chiropractor. I guess because I am a chiropractor, I think that everybody should go to one, which I do believe that. But I'm surprised usually by the number of people that have never heard of a chiropractor or chiropractic in general. Or I've heard the opposite, where people are kind of scared to go to a chiropractor, which I never really understood that. But I think it's just because there's not a lot of information from some people. They don't really know what we're doing, what the goal of chiropractic care is, or they watch the famous videos that they see on like TikTok, Instagram of people jumping out of helicopters with skeletons and things like that. That's not what chiropractic is. That kind of, in my opinion, it kind of gives chiropractic a bad name because it makes fun of something that is one of the most natural forms of healthcare out there versus your other options. But like I say, I just want to kind of get into a little bit about what chiropractic is, at least kind of take you through how I talk to my new patients about it, at least. Typically in my office, what I do when a new patient comes in is I sit down with them and kind of give them a little education as far as chiropractic goes and what it really means or what it really is. But first of all, I tell patients that chiropractic is one of the most natural forms of healthcare out there. And I say that because it's very safe, it's very effective, and most importantly, it's non-invasive, such as the other forms of healthcare like drugs, surgery, things like that. Now, I'm not necessarily saying that drugs and surgery are always a bad thing. They definitely are necessary. We do have need for them, obviously. But I tell patients drugs and surgery help in certain situations, but they should be the last resort, not the first option. I feel like in today's society, you turn on the television and, what do you see? You usually see commercials for, drug advertisements, and they make it seem so pleasant when you're watching people happy and laughing and communicating, talking and with each other while you're listening in the background. Possible side effects may include, nausea, dizziness, heartburn, diarrhea, yada, yada, yada. And I'm like, if you really listen to what those commercials are telling you, they're not really worth taking, or I wouldn't want to take something if it's going to give me something else. And that's kind of what happens sometimes when people do take medication. They're taking medication for one thing, maybe like high blood pressure or something like that, but then they're taking another medication to counteract the dizziness that this medication's doing for the other one. So it doesn't really help, as in my opinion. It's more of a band-aid for a situation. And that's why I tell patients, you can't medicate your way out of a problem that you behaved your way into. That's why I tell patients, like headaches. A lot of headaches are usually caused by either poor posture or dehydration. And both of those are easy fixes to those headaches versus just taking like a Tylenol or some other kind of pain reliever that's really just going to slap a Band-Aid on there to trick your brain into thinking that the problem is fixed, obviously until it wears off, and then you have to take more. And then, like I say, your body builds up a natural resistance to certain medications, so you have to end up taking stronger and stronger prescriptions for something that's a simple problem. And that's why I tell patients, you can't medicate your way out of a problem that you behaved your way into. That's pretty much what I explain with that. But chiropractic in general, what it does is it allows the body to do the one thing that it's really good at doing, which is fixing itself, healing itself. But it can't do that if it's not communicating with itself. And that's why I look to the spine as the most important part of the body, because not only does it protect your brain and your spinal cord, but it kind of works as like the circuit breaker in your house, so to speak. So if you look at your spine as a circuit breaker, and all the nerves that are coming out of the spine are obviously the breakers, each section of the spine is responsible for controlling different organs and different systems inside your body. So, for example, in your neck, your cervical region of your spine, that's controlled all your brain, your neck, your ears, eyes, nose, throat, and also that's where the nerve roots come out that innervate the hands and the arms. People that have carpal tunnel issues, things like that, they typically will have neck subluxations that can cause that, because that's where the nerve comes from. So, for example, if you have a trip breaker somewhere in the house and the circuit breaker, it's going to cut the power to some part of the house. It's not going to shut down the whole house, it's just going to shut down part of it. And that's kind of what happens with a subluxation, and I'll get to that in a minute. But a subluxation is basically the medical term for a misalignment in your spine. So when you have a subluxation, kind of think of it as you're tripping the breaker, so to speak, and that's kind of cutting the power to that organ, system, whatever, and then eventually that loss of communication is going to trigger the brain into saying, hey, something's wrong, we need to figure out what's going on. And that's why I tell patients that that's where pain comes from. Pain's actually a good thing. Pain is your body's check engine light, smoke detector, however you want to call it, because your body's very smart. It has to continue to function, otherwise you're dead, right? But like I say, the body has its own alarm system built in that allows it to alert you when there's a problem, so that way we can kind of figure out what's going on. So if the check engine light or the smoke detector is going off in your house, obviously I would hope that your first instinct is to locate the problem and then put the fire out if there is a fire, versus just taking the batteries out of the smoke alarm to stop the noise. And that's the kind of analogy that I use for a lot of patients when I'm talking about the difference between what we do and what medication tries to do, because when we are trying to fix the actual cause versus just putting a Band-Aid on it and just covering up the noise when you do with medication. And that's the big difference there. Because when you have a subluxation, you introduce a short circuit, so to speak, in your nervous system, and that short circuit will eventually cause problems within your body. And now, like I say, as far as damage, where damage comes from, damage happens obviously one of two ways. It can either through an incident, which hopefully doesn't happen every day, things like car accidents, slips and falls, sports injuries, things like that. Those are big incidents that can cause a lot of damage at one specific time. The birthing process is a huge trauma for both the mother and the child. That's why I usually am pretty adamant to get mothers and babies in here as soon as possible, especially if they're undergoing birth or they're pregnant, because like I say, chiropractic can help with a lot of that, but that's for another topic for another day. But like I say, 9 times out of 10, most people's problems come from daily activities that we do every day that we're not even thinking about. Things like sitting or standing behind a desk for long periods of time, not getting enough sleep at night, poor posture, dehydration, stress, anxiety is a big one. Those little things that we do every day that we're not really thinking about, that we're so used to doing, that causes more problems overall than any other car accident would, just because over time it builds up to be more than a car accident would. But that's basically the two types of damage that most people encounter on a daily basis. Now, if you introduce a subluxation into the system, so like I say, if you have a subluxation in your upper back, which most people do from sitting behind a desk, looking down at their phone, things like that, you might tend to kind of start having things like some soreness, some muscle spasms, a little bit of pain here and there. But then if you don't get that corrected over time, that lack of communication will even start to cause things like some acid reflux issues, or even some ulcers or breathing issues or stomach issues, or even allergies and asthma are contributed to things like that. So that's why I tell patients that chiropractic is not designed to be a cure for anything, but it can help with everything. And the reason I say that is because chiropractors are basically the electricians and the mechanics for the human body. You go get your car oil change, tires rotation, things like that to maintain it, but you don't do that with your with your body, and your body is so much more valuable than your car and your house, and you can't replace it as easily that way. And that's why I tell patients that, we as chiropractors are responsible for making sure that your body is communicating at 100%, talking to itself at 100%. That way you can function at 100%. I mean, it's as simple as that. So when a patient comes into my office, after I go over information, kind of sit down with them, talk about what they're having pain, why they're having pain, kind of give them information on, okay, what's causing all this. Now we can start talking about how we're going to fix it or how we're going to help resolve the issue. And the only way that chiropractors can resolve the issue is through obviously the adjustment. And I tell patients the chiropractic adjustment serves three purposes. Number one, it will reestablish that communication that your body has lost. If we reestablish communication, we restore power, things start to work better, and your body can recognize the problem and it can function better. And like I said, that kind of leads into number two. Once you restore the power or communication, you start to feel better. You start to move better. You get that range of motion back. You start getting a better mood. You start feeling better. And not only that, but then you can start to reverse the damage that's already happened, and you can prevent it from happening in the future. And that's the big point that I want to make with chiropractic care, because chiropractic is very similar to dentistry in the fact that we're both preventative care most of the time. Because you brush your teeth not because you have a cavity, but you're trying to prevent cavities. Just like you don't brush your teeth because your breath stinks. That's not the reason to do it. You're brushing them to prevent cavities, and that's the reason why you go to the chiropractor, is to prevent subluxations or to eliminate subluxations, so that way you can have better health throughout your life, because you're not going to stop doing things. People tell me all the time, well, why can't I just come in here and get adjusted and then not have to come back? Or can I come back when it hurts or something like that? Well, I mean, you most likely can. It's your body. It's your prerogative. You can do whatever you want. I just tell patients that chiropractic is more of a lifestyle. It's like brushing your teeth, working out, eating healthy. I mean, you have to take care of yourself. It's a daily struggle. We all don't do that self-care as much as we need to, but I tell patients that you have to take care of your body while you have your health, because it's a lot cheaper and it's a lot easier to stay healthy than it is to get healthy, I should say, because your other alternative is doctor bills, hospital bills, surgery bills, and those are for those cases that are pretty far gone. And you're never too old and you're never too young to take care of your spine. That's why people ask me all the time, well, what ages are the best to get adjusted, or can I bring my kids in there? Am I too old to get adjusted? No, it's never too old. As long as you're above the ground, you can get adjusted. And that's why I tell patients to bring in their kids when they're young, because you can usually fix a lot of problems when they're still growing versus when they're still when they're developed. But like I said, the longer you wait, the longer it might take. I mean, if I have a 65-year-old patient come in my office that's never been to a chiropractor before, it might take a while to kind of get some results out of that, just because we're dealing with a lot of rust is what I usually tell them. But it's still never too late, like I say. But the longer you wait, the more risk you have of doing permanent damage to yourself. And that's when surgery may be a viable option, just depending on the person's case. But everybody's different. But like I said, when patients come into my office, I usually recommend a care plan based on their needs, and I break it down into three parts. The first phase of my treatment I usually call pain relief. That's typical. I mean, most patients come to the chiropractor because they're having pain. So I tell them that this whole phase of that care is usually just to reduce the inflammation that's happening, let your body heal, let it recover, put the house fire out, so to speak. So that way, once we start cleaning and rebuilding, it's a lot easier and you feel better when you're doing it. And then phase two of my care, once I get them past pain relief, then I start building them back up. I do stabilization care. Stabilization care is like going to the gym. You're retraining something. I've got to get your body to remember what normal should be and not what normal has settled for. Because I hear that a lot of time. Oh, this is the new normal. Oh, I've dealt with that for 30 years. This is how it's always been. There's no such thing as the new normal. You've just settled for where you are. I have to get your body back to where it's supposed to be, and the further gone it's been, the tougher it might be, and the longer it might take. But like I say, consistency is really the key for that kind of treatment. And then once I get patients feeling better and get them stable, then the goal is wellness care. And this is the part that some patients don't really understand when it comes to chiropractic, because this goes back to brushing your teeth. This is the maintenance part. Wellness care is no more than maintenance. Just think the brushing your teeth, changing the oil in your car. That's maintenance. You do that without thinking because you know that will prolong the life of the car or your teeth if you take care of them. Well, the spine's no different. Wellness care is just that. It's maintaining this state that you should be, and that way if you keep on top of the maintenance, you will feel much better down the road. And if something does happen, which it usually will, I mean, we can't escape life, but if things happen, your body is able to withstand it a lot better than when you were before. Like I have patients that tell me that they threw their back out getting off the couch to change the channel. And they wonder why that even happens. And I'm like, well, it's not the fact that you did that. That was just kind of like the straw that broke the camel's back, so to speak. Your body has just been so abused and you're not taking care of it the way you need to, and then doing a slow, simple motion like bending over the wrong way can really throw something into spasm like that. But like I say, that's usually what I talk about with patients as far as getting them to understand what chiropractic is for. And then obviously after the adjustment, I do let them know that, this is sometimes new for people, especially if you've never been to a chiropractor. Your body might be sore. It might kind of feel like if you've been to the gym and haven't been to the gym in a long time, your body might be sore. And I say that's normal. Any soreness within the first few visits is what I tell patients typical. Your body's processing the information, which is good. That means it's recognizing, hey, you're restoring power. Let me fix the things I haven't been able to fix for a long time because the power's been cut off. That's kind of what I talk about. And I throw a little tidbit in there for patients just to say, your health really is not an expense. It's always an investment. If you look at your health as an expense, you're never going to spend anything on it. But if you look at it as an investment for the long term, you can never spend enough on it. And I tell patients, if you treat your body like garbage, you're going to feel like garbage. I mean, that's just common sense. We can't always control situations, genetics, the environment, things like that. But your health is dictated primarily by the choices that you make. So you have to make a choice. Do you want to choose every day to live healthier, make healthier decisions, or do you want to maintain sickness, which is what a lot of people are doing when they're taking the other? There's only 4 options to health. You can either get chiropractic care, you can take medication, you can have surgery, or you can just deal with it. And those are the 4 options, in my experience, that usually are presented to people, and I don't want those to be the only options. So I encourage people to definitely get out, look into chiropractic, talk to me, talk to another chiropractor that you like. Definitely take time to take care of yourself, because that's really all chiropractic is boiled down to. It's self-care. And if you do not take care of yourself, you can't get upset when somebody else doesn't, because you are the decision maker for your health. And I want you to be the healthiest person that you can be, and I'm here to help any way I can. If you'd like to learn more about something you just heard, or are interested to see how chiropractic care can help you, you can visit our website to schedule an appointment at newdirectionschiropractic-nc.com. Be sure to follow our social media accounts for more tips and information on how to be a better you. Thanks for listening.